So I'm a physiotherapist, working in a clinic. I do manual therapy, rehab training, all sorts of things.
Yeah.
Now, people hear physiotherapy, most people think is somebody who's, digging the elbow in, sticking needles in and whatnot. And though that's, part of my toolbox, it's not my main passion. It's my passion. It's pretty similar to yours. It's probably why we're sitting here today as well. It's just, empowering people and get people better. And in my opinion, you get people better mostly by, educating them, taking this like fear avoidance away and empowering them to actually how to fix their own issues. So if they come across similar stuff again, they know a bit what to do. So over time, they should actually need me less. It's a bit grotesque because I shoot myself in my own foot.
I was going to say, mate, you're kind of doing yourself out of business.
Yeah, I tell my patients usually, my job, they said, you don't want to see me again right now? I said, no, I'm trying to get rid of them. I try to get all your friends, but ideally not yourself for the same problem. So that's what I do in the clinic. I've been around for quite a while, and this for a bit over 20 years. Yeah, you've been in
Dubai
17 years.
Sure.
Doing this for a little bit over 20 years.
Wow.
And started an online business as well, where I do remote rehab coaching.
Yeah.
Therapy. When I say remote therapy, people think I'm just going to Zoom calls and ask people to do 10 reps and 3 sets. That's not how it works. It's more. It's again the same thing. Essentially, it's assessing things. What is the problem? Educating people about what their current conditions or limitations might stem from, and then make them plans. Make them, and not just. It's self-treatment, self-release techniques, but also then training plans, which is where we have, a lot of overlap, because ultimately that's what rehab is getting somebody stronger, more mobile and more capable.
People that are listening, I think almost like you said, will be thinking that's not a traditional perception of physiotherapy. And it's probably, we could probably zoom out a little bit. The medical industry as a whole, we go to when we're sick or not feeling good, or our backs bent over double, like we were talking about earlier, our friend Chris, and we're like, fix me.
Yeah.
Whereas you come, and you said it right, mate, this is why we've always probably had a good relationship, because you come from an area that's like, actually, I don't want to see you that much, but you're very rare. Mm-hmm. Because most people, anyone that's listening that's had, lots of people would have had knee surgeries, and with a knee surgery comes a standard 12 physiotherapy sessions, and you're the physio and you're going to come and see me Monday and Wednesday for the coming 6 weeks, and everything's going to be fine. But it never is. So you're almost at this opposite end of the spectrum, where you could sell people these 12 sessions, but you're like, I don't know. And that's where we always got on from the start. Is like, I don't know, but we'll try this and try that. My question is, where does that come from? If all other practitioners are, not all of them, because I have to be careful, because I've had some practitioners on the show as well, but a lot of practitioners are literally, mate, they're locking us in for 12 sessions. Yeah. Where does your alternative approach come from?
Very good question.
It's quite long-winded, mate, but that's, because it's not normal.
Well, for me, it kind of is, but it's an evolution as well a bit. I mean, I don't know. I mean, I've never been a friend of this like standard treatment protocols. There are certain protocols which work and they have to be in place, but it's, if let's say somebody comes after knee surgery, as you mentioned, right? So, in the beginning, there's obviously a lot of stuff. This is a bit overwhelming for a patient. This is now post-operative or post-injury. Yeah. It's scary. Somebody has never been injured, so they probably need me a bit more then, because I need to encourage them. I need to explain to them, look, this pain is perfectly normal. Asking me where that stems from. I had a ton of injuries myself. That's how I ended up in this industry in the first place. And I think you would agree with this. Pain and injuries are good teachers, right? Yeah. And you learn. I could never do what I do today if I would never have been injured. I believe it's actually impossible to be a good therapist or medical practitioner if you treat stuff you never went through once.
That's
at least,
interesting.
Probably multiple times yourself. And so it helps to relate to patients, and I realize, okay, he knows, he's been there, and that's exactly how I feel. And you tell them, look, that is that is dangerous or that is not dangerous. Most stuff is not dangerous, right?
Yeah.
It's just painful, and pain means scary, but it shouldn't be. And so in the beginning, I would say, when he said these 12 sessions, well, it's not that I never see anybody at a certain frequency, but what will never happen with me is to say, okay, twice a week, full stop. That's not what I do. But in the beginning, I have a lot to explain, a lot to teach, and the quicker the penny drops, right? When you realize, okay, now I got him on board, he walks out already more relaxed because he's more confident, and then you need to build some basic programs, right? You need to give them certain skills, you need to make sure the execution is good, and once I feel like people got it, they execute things well, then you can literally just make them programs and say, look, do this until, let's say, 2 weeks or 3 weeks, and come back with others, might be in a week's time. And then we adapt, right? You scale things up because I always say rehab is training in the presence of an injury most of the times. I mean, there are others, right? There's people with just a lot of pain and they really need your help. I mean, I'm doing the manual therapy stuff as well. I do, mobilize or manipulate a joint or release that trigger point. But ultimately, it's like learning a language, right? You go to a language lesson, you don't speak the language, you need to practice it. And so putting that into practice in your daily life and how you can do this I try to develop techniques how people can do a similar thing to themselves on demand for free whenever they want, right? And I find that's empowering.